the Clinical Judgment Measurement Model, CJMM, for nursing students. Today we're going to talk about clinical judgment, not as a buzzword, not as an NCLEX scare tactic, but as the thinking framework that turns nursing knowledge into safe patient care.
Clinical judgment is how nurses combine knowledge, skills, and attitudes to make sound decisions in real clinical situations. This is how you move from student nurse to professional nurse. The clinical judgment model we use in nursing education and on the NCLEX was developed by the National Council of State Boards of Nursing. It has 6 steps, and each one builds your knowledge, skills, and professional attitude. Let's walk through it together.
Step 1. Recognize cues. Recognizing cues means noticing what matters right now, not everything but the important things. This includes vital signs, patient statements, behaviors, lab results, and changes from baseline.
Here's what you're developing. Knowledge. Knowing what's normal versus abnormal. Skills, focused assessment, and observation. Attitude. Curiosity and situational awareness. Ask yourself, what am I seeing, hearing, or noticing that should catch my attention?
Step 2. Analyze cues. Now we make sense of the data. Analyzing cues means looking at findings together, not in isolation. You compare, connect, and look for patterns. This is where nursing diagnosis thinking begins. You're building knowledge, understanding pathophysiology and clinical patterns. Skills, critical thinking and pattern recognition. Attitude, slowing down instead of jumping to conclusions. Ask yourself, what do these cues mean when I put them together?
Step 3. Prioritize hypotheses. This step is all about safety and urgency. You may identify several possible problems, but you must decide which one matters most right now. This is where you apply ABCs, Maslow, and risk assessment.
You're developing knowledge, safety principles, and prioritization frameworks. Skills, decision-making, and clinical reasoning. Attitude, accountability, and a safety-first mindset. Ask yourself, if I don't act, what could harm the patient first?
Step 4. Generate solutions. Now you plan nursing actions. This step focuses on what the nurse can do, independently or collaboratively, using evidence-based care. You're not jumping straight to provider orders. You're thinking like a nurse.
You're building knowledge, nursing interventions, and scope of practice. Skills, care planning and anticipating outcomes. Attitude, confidence, and patient advocacy. Ask yourself, what nursing actions will best address the priority problem?
Step 5. Take action. This is implementation. You carry out the best, safest intervention, whether that's a skill, education, communication, delegation, or escalation of care.
This step requires knowledge, policies, procedures, medications. Skills, technical skills, and communication. Attitude, professionalism, and calm under pressure. Ask yourself, what is the safest action I can take right now?
Step 6. Evaluate outcomes. Clinical judgment does not end with action. You reassess, evaluate, and decide what happens next. Did the patient improve? Do you need to modify the plan? Do you need to escalate care?
You're developing knowledge, expected outcomes. Skills, reassessment, and evaluation. Attitude, humility, and lifelong learning. Ask yourself, did this intervention work? And what do I do next?
This is why instructors ask, what's your priority? Clinical judgment is how nurses protect patients. It's how you combine knowledge, skill, and attitude into safe care. You are not just learning tasks. You are training your brain to think like a nurse.
And that thinking will carry you through clinicals, NCLEX, and real-world practice. Clinical judgment isn't a talent. It's a muscle. Now flex it.